Hello, I'm Erica Austin. I'm with Washington State University, and we've been working together with the Extension Collaborative on Immunization Teaching and Engagement, or EXCITE, to develop a toolkit to build confidence as a trusted messenger of health information. The toolkit has three components: motivational interviewing, science media literacy, and neuromarketing. And we've put together a series of workshops for you to introduce the toolkit. You can look at these modules online in any order, and the modules introduce the toolkit. And the toolkit includes, as well as these online modules, you can look at the toolkit, which includes brief self-guided lessons, examples for practicing your skills, handouts to share with others, and references and sources for more information. I'm presenting about science media literacy, and specifically, this module is about the science behind science media literacy. The point of this series is that we have to help people find trusted sources and trustworthy information. We're not trying to tell anybody what to think, but we want to help you to find the trustworthy sources and information that can help you make decisions that are best for you. The Science Media Literacy Toolkit authors are myself and Dr. Sean Domgaard, who will be presenting the other two modules in this three-part series. Because we think that sources are so important for you to be able to trust and to know whether you should trust, I'm going to tell you just a little bit about myself. I did my graduate work at Stanford University, and I have been doing research and outreach on media literacy and health promotion for over 30 years. I'm a fellow of the International Communication Association, and my research has been cited in policy papers by the American Academy of Pediatrics. You can check out my expertise by going to someplace like Google Scholar and starting to look at some of my research. We hope that this session will help you to understand how risky and how common it is to have more media confidence than media literacy skills. There's some pretty compelling research about this. You can also understand how surprisingly informative emotion can be in decision-making about media. Of course, people talk about how important it is to be a critical thinker about media, but your emotion can be informative too. You can visualize how media literacy can improve your decision-making processes, and then we'll end with 4 steps that can help unmask misinformation and promote healthy decisions that are right for you. As I said, we're not trying to tell you what to think. We want to help you make the decisions that are right for you. In our first session, we established that science media literacy is healthy skepticism. Dr. Domgaard went into some detail about that, and you can also get more about this in the toolkit. On page 60 of the toolkit, we go over the information that's on this page here. Science media literacy and media literacy generally is the ability to access, analyze, evaluate, create, and act using media in a variety of forms, in this case for science information. Science media literacy principles can be summarized this way. All media messages that contain information, in this case about science, are constructed. That means they're made by people, and they use medium or context-specific techniques. Media messages that contain information, in this case about science, are constructed by people. They are produced for particular purposes. That means they have goals. All messages that contain information are going to have values and points of view that reflect the person who made them. And people construct their own meanings from media messages that they access and that contain information based on their own skills and their experiences that they bring to their experience of using media. Media and media messages about any topic, in this case about science, can influence people's beliefs, attitudes, values, behaviors, and society. When we have more confidence than skills for using media, we risk sharing misinformation. This is a really cool study that was done about this. There's a link here so you can go to the study yourself. It's also linked in the toolkit. And in this case, they did some survey work, and they found that 3 in 4 Americans who were surveyed were overestimating their ability to distinguish between legitimate and false news. And then what was happening was they were less likely to distinguish between legitimate and false news. And they were more likely to visit untrustworthy websites and share false content with other people. They were less aware of their own limitations. So being less aware of their own limitations made them more likely to visit untrustworthy websites and then share false information. You can imagine what happens, and tons of misinformation ends up getting shared this way. In addition, we've done some research on this ourselves. We also find that people who have more confidence than skills end up using information ineffectively for their own selves, and they can make poor decisions about their own health. This can really be risky. A key to misinformation prevention, and also to misinformation unfortunately spreading, is trusted sources. And this was a really nice article that was published recently, and we link to this in the toolkit. You can go take a look at it. And it's a fundamental tool for media literacy and for misinformation, that we rely on trusted sources. And unfortunately, sometimes these relationships get overlooked in communication campaigns and in journalism. As it turns out, trusted sources in the community can help combat misinformation on the internet. What happens is, when people don't have local sources they can trust to check out things that they feel uncertain about, when people are feeling uncertain, they start looking for information, and they'll start turning to social media, and they can fall to charlatans who are really good at taking advantage of people's insecurities and also their mistrust of certain groups. Our toolkit has a vivid example of how the spread of misinformation among millions of people during the COVID-19 pandemic could be traced back to just 20 people who were really skilled at taking advantage of other people. So this brings us to our media literacy theory of change. As it turns out, decision-making is partly logical and partly emotional. And when people are using media, this is how it works. We need our emotions to work for us instead of against us. And you've probably heard already a lot that we need to be critical thinkers about media. But our emotions can actually help us with this. You can see the little the bicycle here in the picture, and it's kind of like riding a bike. If we have a certain amount of skills, just like for riding a bike, we're busy people. We can't be critical thinkers trying hard, using our brains really hard all the time. But it's like riding a bike. Sometimes the route we're taking on our bicycle doesn't take a lot of effort. If we have a certain amount of skill, we can use our balance and we can ride that trail without a whole lot of effort. But if we look ahead, if we're forewarned that there's going to be a difficult trail coming up, we know we have to use some extra effort to traverse that difficult trail. It's the same thing with media messages. If we have some forewarning that a message might require a little bit more effort, we can use our critical thinking skills to test that message a little bit more carefully. So if we have some forewarning that maybe a source isn't going to be as trustworthy, or maybe a message might be a little bit more important and requires a little bit more effort, maybe we can use our critical thinking skills more carefully. So we can use our emotions as a cue, a really valuable cue, that perhaps a source might not be so trustworthy, might not have our best interests at heart, or maybe a message is a really important message that we need to think carefully about. So critical thinking about sources can motivate critical thinking about content, which can facilitate beliefs, efficacy, which is confidence, expectancies, which are if-then beliefs, such as about whether a source is telling us to expect certain results, whether we're going to do what they have advised us to do. Is that going to give us the results, really, that they expect us are going to come as a result of doing what they have advised us to do? Those are expectancies, those if-then beliefs. So then if we intend to do something, maybe we'll actually get it done or not, like voting or following through on a health behavior, then those outcomes may or may not come to pass. So critical thinking about sources can motivate critical thinking about content, which can facilitate those beliefs, efficacy, and expectancies, which can affect those outcomes. Our emotions can help us as cues about whether, those can be really good forewarning about whether we need to really activate that critical thinking to facilitate careful thinking that can help us with those beliefs, activate our confidence that can be really well informed about those outcome intentions and behaviors. The problem is that sometimes sources try to disrupt our freedom of choice. They can distract us from thinking critically by trying to convince us, like me, trust me, do what I tell you, and don't trust other people. Don't look at multiple sources. One of the really great things about media literacy is that it teaches us that we should look at multiple sources of information, and we should test content to make sure it's up to date and complete and accurate and all of those great things. Forewarning about sources can motivate us to do that careful thinking. If we're really sure we can trust a source, then maybe we don't have to think quite as carefully about the content. But some sources are going to try to convince us that we don't need to do that critical thinking when maybe we really should. And that's what those 20 sources in the pandemic convinced millions of people to do, and what they were really sharing was misinformation. Now, I don't have a lot of time here. I don't want to take a lot of your time. I know you're really busy. But I'm going to share with you today an infographic. And Dr. Domgaard, in the next module, is going to practice with the infographic on how to use it so that you can become a real expert with this thing. And also our toolkit can give you some practice with the infographic. And we also have some other tools for practice about science media literacy that you may find really useful, and also more science about why and how this should work. And so you can really look behind the research to see why this model of media literacy is really effective. In any case, you can deploy these steps in any order. Even though you see 4 steps here, you do not need to do this in the order that you see here. But the steps are: consider the source, examine the content, check your emotions, and ask trusted experts. Now, you might do a gut check of your emotions as step number 1. That can be a really good way to consider whether you need to think carefully about a message or not. If a message makes you feel anger or FOMO, that fear of missing out, a message may really be too good to be true. Stop and think before sharing or believing an upsetting message or one that feels too good to be true. And don't be shy about asking trusted experts, and think about whether experts really, really can be trusted. Librarians are wonderful sources to check with, and people in your community. There are often really great experts in your community who you can use as trusted experts, and maybe your trusted experts other people can rely on as well. Our next workshop will help you practice using the infographic, and I encourage you to check out the other workshops in our series as well. I want to thank you for watching and learning with us today, and I'd like to thank the Excite Foundation through its interagency agreement with the USDA National Institute of Food and Agriculture and the Centers for Disease Control and Prevention for funding this project. We hope this toolkit is helpful to you and your communities. Thanks for visiting with me today, and take care.